Molds. True pathogenic fungi are capable of causing infections in healthy, normal hosts, often affecting the skin or subcutaneous tissue. Many of these fungi are systemic dimorphic fungi, which exhibit two distinct forms depending on the environment: a mold form in the environment and a yeast form in the host. These fungi typically have a restricted geographic distribution, meaning infections occur primarily in specific regions. Infections caused by systemic dimorphic fungi are often asymptomatic or self-limiting, and individuals usually develop resistance to reinfection. Importantly, the parasitic yeast phase that occurs within the host is not infectious to others, limiting direct person-to-person transmission. A true pathogenic fungi can include Histoplasma capsulatum and Blastomyces dermatitidis. These fungi exhibit two distinct forms during their life cycle. The mycelial form, also known as the saprophytic phase, exists in the natural environment where the fungi lives as mold. When infecting a host, they convert to the parasitic phase, which is typically a yeast form found in infected tissues. An exception is Coccidioides immitis, which is a parasitic phase form spiracules containing endospores rather than typical yeast cells. These are all primary infections in the lung, and so your mode of transmission is inhalation of the airborne Candida. In the lab, we will need to determine or be able to demonstrate conversion of the mold to the yeast form to confirm. With Histoplasma capsulatum, it grows as a mold in nature. In the parasitic phase, it will be a small oval yeast. It is found in the endemic areas of the Midwest, Ohio, Tennessee, and Mississippi rivers. Histoplasma will thrive in soil that has high nitrogen content. Histoplasma is also found where birds and bat droppings are located, so think like chicken coops and caves. Histoplasma capsulatum will cause histoplasmosis. And it can be asymptomatic, but if it becomes disseminated, spreads through the body, it can result in death. The degree of infection will depend highly on the state of the person's immune system. So this is an infection of the reticular endothelial system. Treatment is usually amphotericin B. If the Candida are inhaled, then it becomes a bronchopneumonia. AIDS patients, remember, they are typically immunocompromised, so this is the third most common fungal pathogen for them. Histoplasma is often seen in peripheral blood smears in AIDS patients as well. Coccidioides immitis is a causative agent of coccidioidomycosis, also known as valley fever. Infection typically occurs through inhalation of Arthrochlamydia, which approximately 60% of cases being asymptomatic. The remaining 40% may experience mild to severe upper respiratory tract infections that are often self-limiting. However, in some individuals, particularly those who are immunocompromised or have other risk factors, the infection can become disseminated and potentially fatal. Disseminated coccidioidomycosis may involve the skin, subcutaneous tissues, meninges, and internal organs. So the severe cases are going to be treated with amphotericin B. In the host, the Arthrochlamydia of the Coccidioides immitis undergo conversion into large, thick-walled spiracles, which contain numerous endospores. This spherical form is characteristic of its parasitic phase. C. immitis is endemic to the southwestern United States, particularly in areas such as Arizona and California. It thrives in alkaline, sandy soil, especially in regions like California's San Juan Valley, which is why coccidiomycosis is also known as valley fever. So P. brucellosus is the causative agent of paracoccidioidomycosis, which typically begins as a primary pulmonary infection. From the lungs, the disease can disseminate to the mucous membranes and other tissues, including the skin and lymph nodes. This fungus is a soil inhabitant found in Central and South America, particularly in rural agricultural regions. Interestingly, estrogen has been shown to inhibit the transformation of the mold to the yeast form, which is required for the infection in humans. As a result, clinical disease is far more common in males, typically between the ages of 30 and 60. Blastomyces dermatitidis causes a chronic granulomatous infection of the lungs, typically acquired through inhalation of airborne Candida. The initial pulmonary infection can resemble other respiratory illnesses and may go unrecognized. In some cases, the infection disseminates from the lungs to other parts of the body, most commonly the skin, resulting in characteristic skin lesions. In tissue, blastomyces appear as large, round, thick-walled, hyaline yeast cells with broadly attached blastoconida, often described as having a broad-based budding appearance. This organism is endemic in regions surrounding the Mississippi, Ohio, and Missouri River valleys, as well as southern Canada, the Great Lakes region, and parts of the mid-Atlantic coastal states. Amphotericin B is the treatment of choice for severe or disseminated cases. These organisms are suspected, or when they are suspected, they will be worked in a biosafety level 3 hood. And so we need to have protocols for specimen collection and transport as well for safety. Most of your specimens are going to be sputum and respiratory secretions. You will want to process these as soon as possible. These dimorphic fungi are sensitive to contaminants and environmental conditions. You do need to do, or you can do, a direct exam. However, you may need to concentrate that specimen to be able to see what you're looking for. You could do a KOH prep, a gram stain, a periodic acid Schiff option, and the fluorescent antibody stain can also help to visualize the organism. Culture and media. So use media with and without your antimicrobial agents. Yeast extract phosphate medium for Histoplasma capsulatum from sputum. You would incubate at 30 degrees Celsius and look at it every 2 to 4 days with sealed plates. And again, plates are and always open in a biosafety level 3. Coccidioides immitis is 4 to 5 days growth is how long it will take to grow. Histoplasma capsulatum and Paracoccidioides brasilinus may take up to 2 to 3 weeks to grow. Once you do have growth, though, then you can do a lactophenol cotton blue stain to look at the arrangement of the spores and try to determine what you got. Identification of your systemic fungi must be confirmed by conversion of mold to yeast in spherical form. We can use the antigen from culture in an exoantigen test. So again, there are actual antigen techniques you can do, molecular probes, things like that. Immunology could be a skin test for delayed hypersensitivity, or it could be in the laboratory via a complement fixation, immunodiffusion, latex agglutination test, or competitive immunoassay. We also have radioimmunoassay, which is oftentimes a methodology for detecting Histoplasma capsulatum for diagnosis as well as monitoring for the treatment of that.